My name is Prisha Mosley. I was 15 when I began my social transition with a legal name change of hair and clothes, and by binding my breasts. Even social transition is dangerous, and step 1 caused permanent damage to my back and ribs. I already had pre-existing diagnoses of OCD, anorexia, anxiety, depression, and borderline personality disorder when I saw my WPATH certified gender therapist at 17 years old. The trans community found me vulnerable and naive and convinced me that I had been born in the wrong body. They told me I needed a letter of recommendation which would unlock hormones and surgery. So I went online without my parents and found the therapist who wrote me my letter in one 15-minute appointment. Testosterone was injected into my anorexic body by a pediatric endocrinologist in the same hospital where I was seeing a nutritionist for my severe eating disorder and receiving stitches for cutting. Testosterone was covered by insurance, and I was assured that if it wasn't, my doctor could make changes to the codes to make sure it was. I live in constant regret and frequent sorrow, but the regret is not the worst part. Testosterone had severe side effects which have robbed me of my quality of life. I am in pain. My neck, back, and shoulders burn, and it will never stop. My joints ache. My genitals are painful and atrophied. I have heard that what has happened to them be compared to female genital mutilation, and I agree. Parts of my vagina have atrophied away. It is so small that I can no longer use tampons. I suffered for years with ovarian cysts, for which I went to the emergency room. I was told that testosterone caused my uterus to fold over, and there were signs of uterine prolapse. I do not know if I am fertile, but I do not believe I am. I am 25 now and received help from my mental health and trauma and want to have children now. But what I do know is that I will never be able to breastfeed. My breasts were removed. I felt like they never belonged to me, and they are gone. I will go my whole life without knowing how it feels to feed a child, and I will suffer with phantom breast syndrome instead forever. Testosterone took my singing voice away. I used to be an operatic singer, and I wanted to have a singing career when I was young. I cannot do that with a crushed larynx. Testosterone causes the overgrowth of many parts of the female body, and what happens on the outside happens on the inside as well. My wide shoulders match my thickened, widened heart and increased risk for heart attack. I am also at increased risk for stroke. My life has been shortened by testosterone abuse. My trauma and mental illness made me susceptible to 2 social contagions. It started with anorexia and was followed by gender ideology. The difference is that my anorexia was not affirmed by my doctors or the adults around me, but my trans identity was. I was denied liposuction at the same time that my breasts were cut off. Teenage girls are a demographic known for falling victim to social contagions. Please protect others from becoming permanent medical patients like me.
Ms. Mosley, thank you very much for your story and for being with us today. Committee, we'll start the questioning with Ranking Member Liston.
Thank you, Chairman. Thank you for sharing your story. I'm sorry for all of the pain that you've been going through. I do want to just poke a little bit about one portion of the story so that I can make sure I understand the process and how it relates to the law. You talked about experiencing some of the social transitions younger and then seeking out hormones at 17. But what you're describing to me, I want to clarify the time frame because, in Ohio, you can't get medications without consent before 18. You can't get hormone treatments without consent before 18. So just to clarify, when you actually started testosterone, that was on your consent after you were 18.
I started testosterone at 17. Top surgery was 18.
Okay, and so for the treatments then, were you with family at that time? Did they consent with that? Or was that alone on your own choice?
I brought my family along, and I was in the room when my doctor looked at them and said, would you rather have a dead daughter or a living son? Do you want to pick up her hormones or her body from the morgue?
Okay. So at that time, your family consented to the beginning, and then you did so at the end. All right, and it does sound that that you had a lot of emotional strife at that time. You were receiving other support therapy for the anorexia and other counselors, or no, or is this?
Yes, I was seeing a nutritionist and several therapists from the state as well as private therapists. And in my letter of recommendation for surgery, my therapist even said that all of my pre-existing problems existed because I was born in the wrong body.
Okay. And then final question, how long were you on testosterone, just to get a sense of that?
5 or 6 years?
Okay. All right. Thank you.
We'll continue questioning with Representative Stewart.
Thank you for being here. Thank you for your testimony. It's very important, and I appreciate you stepping up to tell your story. If you haven't, that's okay. But I guess I'm just curious. Have you had any conversations with some of the physicians that were a part of your transition services? Have you expressed to any of these folks your regret over the services you received? And if so, are you able to share any of what their response would be?
So I reached out to that gender therapist and my old therapists and stuff, and my gender therapist said there's no record of me going there. They're literally gaslighting me and ghosting me. My parents even sent in like a notarized, legally binding thing just to get my records and talk to them. And I have emails going back and forth between this person. I'm sure I went there. And they said I never went there. They're literally saying I don't exist.
Representative Samani.
Just one question. Do you know if testosterone's effects are irreversible, reversible, or if some of the effects are reversible and some are irreversible?
I have never seen anyone recover from using testosterone. Your body can't re-shrink. My genitals won't unatrophy. I'm never going back to the way I used to be. I don't know any part of it that's reversible.
Do you know that testosterone has been used in the past for the treatment of endometriosis and also has been used for other medical conditions?
Yes, I am aware of that.
X.
Testosterone is not FDA approved for use in women, and trans identifying people are given incredibly high doses to match the male body. And I actually I told my therapist that I wanted to look different fast and was given a very high dose.
So unfortunately, in the same vein, trans women also have some of the same issues. You know, is that something that they should be forced to suffer from?
Can you clarify a little bit?
So trans women also, you know, have hormones, are given hormones that change their testosterone levels. Is that appropriate or not appropriate?
Puberty is natural and a rite of passage for becoming an adult, and I don't think that anyone deserves to be sterilized to avoid that.
What age do people usually go through puberty?
Like early teenagerdom, maybe a little earlier than that.
So yeah, the average age for women is 9 to 11.
Okay.
Thanks. Thank you. Thanks.
Representative Stewart. Representative King.
Thank you, Mr. Chairman. Thank you for being here with us today and sharing your personal story. You're very brave and courageous, and I thank you for that. And I would ask you to continue sharing your story with others. I do have a question. I'm curious to know what kind of consent or therapy you or your family may have received prior to your surgery. I'm a parent of 2 children who are hearing impaired, and when my youngest was 3, she had hearing aids, and the hearing aids no longer worked for her, and cochlear implant was the only option. And before we could schedule the surgery for a cochlear implant, we were required, my husband and I, to meet with a therapist or a psychologist or somebody within their team to meet with them and be evaluated, to see whether we would have the commitment to help our daughter adjust to the cochlear implant, speech and language, and everything that's required. Were you given that same opportunity, or you or your family, was that discussed with you, whether there would be permanent damage, how this might impact infertility, loss of sexual function, or the lifetime commitment to hormones or therapy? What kind of intervention prior to scheduling surgery were you given?
I had one short appointment with my surgeon before I saw him, but I just got my letter of recommendation, which like unlocks whatever you want. And when I had that letter, he didn't question anything I said. One thing, I was told I would have sensation in my chest in about a year, and it's been 7 years, and I continue to be numb, except I have like occasional zapping pain that's like nerve damage going across my chest. I was given informed consent for hormones, but I was told I wasn't able to give conformed consent for liposuction because I was too unwell. I had gotten out of the hospital like 2 weeks prior to this for trying to die.
Thank you.
Representative Byrd.
Thank you, Chair. Appreciate your testimony here. We've already heard the term gender-affirming care used in this committee already today. I want to know what you think about that term, gender-affirming care. Do you see it that way?
I think it's gender-denying harm. You are denying your birth gender and taking experimental sterilizing medicine and becoming a permanently medicalized patient for life. It's harm, undeniable harm.
Follow up? So would you say that gender-affirming care, that term, is actually a deceptive lie to prey upon unsuspecting people that might fall prey to that term?
Absolutely. It's carefully crafted language, and I would like to point out that if WPATH and all of them really cared about gender-affirming care, they would help detransitioners. I'm trying to affirm my gender as a woman, but I can receive no help. They only care about making people trans because they won't help detransitioning people. It's an agenda.
Thank you, Chair.
Final question lists around to go to Ranking Member Liston.
Thank you, Chairman. This one I think is going to be pretty short. I know we're all trying to figure out policy, particularly for Ohio, and so figuring out the practices in our state is important. I can see that you've testified in South Carolina and in Kansas and in Texas. The experiences you're describing, can you tell us, were they in Ohio?
I was in North Carolina, but if you wait until you have a detransitioner from here, someone's already hurt and you have failed.
Follow up. So, okay, just to make sure that, the discussions and consent practices are not, they were not here. And just final comment, and I would agree that as, the detransition or retransition, as people, do need support. And certainly that would be one of my worries with this bill, is if there's a forced detransition that we, don't have support for those young people that might be impacted if this bill were to become law. So I appreciate you bringing up that need. So thank you.
Thank you.
Ms. Mosley, thank you very much for being with us today. We certainly appreciate your testimony.
Thank you.